real though? For real though. For real though.
For real though.
Hey, y'all for real though?
What's up?
Welcome to the For Real Though Podcast with your host, Albert Cantu.
And Davin, Keeley.
What's up, buddy?
What's up? This is so crazy. So thank you so much to Jack for doing this interview with us.
Yeah, he's
an incredible dude, a great company that he works for now.
Clearwater. This whole episode today is brought to you by Clearwater. We want to specify that. We want to say a big thank you to them for bringing this episode to you today. You want to stick around for the interview with Jack, because Jack, he's got a lot of great information about Clearwater. And if you're in the market for next year, 2024, for health insurance, you definitely want to listen in, because he's got some great deals going on with Clearwater. You don't want to miss that. But I want to talk about, we are right now out at the rim.
Yeah, the lick is right
and
there.
And the lick is right here.
And then Brayson, he's the manager of this location.
Brayson
he was like,
Caruth.
You should try some of our new seasonal stuff. And I was like, yeah, he loves ice cream. So
I do, and I like it. If it says lick, I want to be a part of it.
I don't know about that.
Hey, yeah, but a big thank you to Brayson Caruth. He's at the lick right over here at the rim, and he gave us samples, and we're gonna try each of these. Are seasonal, so I want to try them. What are you trying right now?
This is the one that I've always gotten. It's the goat cheese.
Oh, see, I don't know.
Goat cheese, thyme and honey. It is so good. I know it sounds disgusting. Wait, what's that? Gingerbread?
I've got gingerbread.
Okay,
Let me taste
cool.
it.
You have to try. You have to try this.
If you love Christmas and you want Christmas in your mouth, this is it. This tastes like
potpourri.
This tastes like a reindeer. Like you would be eating a reindeer right here with this. This
Nice.
Gingerbread is so good.
That's great.
The spices in this thing is
Try the goat cheese.
good. Okay, I'll try it.
I know that. Okay, it sounds unattractive. That's what I get every time from them. How do you not like
I don't
that?
like it. It tastes like goat cheese, and I'm not going to eat.
Okay,
I'm
never
just not
mind.
Gonna,
All right, so this is probably not even interesting for people
just come over to
that are drinking out.
Which one's this one?
Plum rum ball.
Oh, that sounds good though. Okay, obviously a classic here, red velvet.
Sugar cookie.
Hold
Oh
on.
my God, you guys have to check out.
I'm
Oh my God, there's cookies in it.
red velvet's okay, but it's not like oh my God, I gotta have that.
What is this?
Gingerbread's still the winner
Peppermint
for
bark.
me. Let me taste this one. Okay, yeah.
Oh my God. Anyways, this is so good. I wish you guys were here with us, but at least you get to see us eat it.
Yeah, ice sugar cookies really good. Oh, let me see. You know what? I was telling Davin, we can get fat eating all this stuff. I don't want to get
That's
fat.
why we have little spoons.
Yeah. Oh.
It's to keep us. Is that your favorite? I think this was my favorite. Plum
Ball?
Yeah.
Candied pecan bourbon.
Oh, that's so good.
Wait, let me taste this real quick, and then we'll be done with this.
just one more bite. That's my favorite
Okay,
one.
here, nope.
I haven't had that one yet.
Okay, try gingerbread. Gingerbread's the best. So you got to come out here to Lick. Come talk to Brayson Caruth.
Holy, it does taste like reindeer.
That one's the best.
It tastes like reindeer.
It tastes like he's had a lot of reindeers. Yeah, no, it's
It has chunks.
man, it's so good.
Oh man, I'm gonna get some more. That tastes like like Hobby Lobby. Like if Hobby Lobby was a flavor, like potpourri.
Man, it's really good. This will be really great, even not just for Christmas, but for Thanksgiving too.
Oh, I think so too.
It's
Yeah.
got that's what it is. It tastes like the holidays.
It does.
This is definitely the holidays.
Yeah.
So come out to Lick over here at the rim. Talk to Brayson Caruth. He's the shop manager here. And they'll hook you up with these cool flavors. They got toppings. The toppings are only $1.
Yeah.
But they've got all kinds of stuff happening here at Lick.
Well, speaking of delicious,
these are kick-ass.
Yeah.
They're kick-ass flavors. And speaking of kicking ass, did you hear that Fred's Fish Fry wants to kick some ass too?
yeah, I heard about this. So it looks like, and I think this happened because the Spurs announced one of these weeks they were doing a specific color scheme to their jerseys, and everyone's like, it doesn't look very San Antonio. So I guess this designer was like, it'd be really funny if we did a Fred's Fish Fry version, and it went viral. It was all over everywhere. Everybody reposted it, and even in the comments, people were like, I want to buy one of those. And so it looks like somebody did put that on the market.
Yep.
And they just got hit with a huge lawsuit.
Yeah, they got a lawsuit now. They're saying here that Fred's Fish Fry is suing because they created, obviously, this Spurs jersey, but they're demanding that all of the profits that are earned from the sales of these jerseys, which are bootlegged, it's bootleg apparel, get handed over to Fred's Fish Fry.
Yeah.
Like they want their money because you use that, even down to just the little blue and red emblems. That all of that is considered copyrighted.
Yeah.
And they're saying, listen, you can't stick our name on this jersey, put the Spurs logo on it, and then gain profits from it, not consulting Fred's Fish Fry. So did you say they probably got the best lawyers?
I know, like you do not want to mess with Fred Fish Fry's lawyers because they keep things hush. You know what I mean? That's that is like the wrath of God.
Yeah. If you've seen the inside of their restaurant, you know they've got the best
you're like
lawyers in town. No, but I mean, I get it though. It is copyright infringement.
Yeah.
I was also thinking, don't you think though that
the Spurs logo's on there?
the
Yes,
Spurs
I know.
could
So
come back and say, hey, you're making it look like Spurs is
say this becomes
endorsing.
hush hush, then the Spurs could potentially be like, hey, you're using our likeness. You're actually using our actual emblem. And that's even huger company.
Yeah, that's crazy.
Yeah, you do not want to mess around with that. You can do things like this, but you can't literally rip a logo off and put it on there because this is exactly the worst case scenario that could happen.
Let me just kind of tell you here. It says the suit was filed earlier this week in the U.S. District Court in San Antonio, and it accuses actually 21 defendants. Now the suit that they filed earlier this week is basically they filed it with the court, and they're actually going after 21 different defendants on this thing here. So I think. Do you think though, because it also gives Fred's Fish Fry, some promotion, right? Like people think San Antonio, that we all have this. Everybody's got these inside jokes about Fred's Fish Fry, but we even had them on our show, right? The actual food, like remember that, and their food's great. Yeah, that's good. So.
And it's now it's like, oh hell no, like Fred's Fish Fry is now in the news, and they're punching back, and they got a lot of local newsworthy from this product now hitting the market, but now with this article, I don't even know, like this is, you got to be careful with talking about companies. You got to be careful with putting their logos somewhere because that gives them pretty much the obligation to go after you. Yeah, you have to be really careful with that kind of stuff.
That's why the internet can really be it can really hurt you if you because I get it. Sometimes you might put something on the internet and think, okay, I'm trying to be funny here, but it can sometimes backfire on you, and you definitely don't want that. Yeah. But I'll be honest with you, I'm not going to lie. The jersey actually looks pretty cool.
I love it.
I think it's a great looking jersey.
And I was saying, like, now it's going to be a rare jersey, so it's going to be even worth more.
Would you wear it?
Yeah.
Yeah,
I wish I was wearing it right now.
And then they come after you too. There'd be 21 defendants. We're suing you, Dad. No, actually, I mean, you'd just be advertising for the Spurs.
I want to be advertising all.
Yeah. You're not making any money off of it.
Yeah, so if somebody's wearing a Spurs jersey, that doesn't mean they're on the team. Put me in, coach. Put me in, Bob.
Put me in. I want to go. I would just run on the court with it. Everyone would love it though. Yeah. So obviously it's sold. So there are people right now that
I wish
have
I would have gotten. Do you wish you would have gotten it?
It's probably going to get pulled off, right? No one's going to be able to order it now because they didn't go through the right channels to get this thing done. But whoever does have it right now is probably going to be, they're pretty lucky right now because it's like now you've got kind of like a one of a kind almost in a sense, right? Yeah. So anyway, Fred's Fish Fry, you do what you got to do. In the meantime, let this be a lesson to all.
Oh yes.
Don't go around using other people's logos for your profits.
It's crazy. Well, let's go to our sponsor and we'll bring Jack in.
Yeah. We've got we're going to cut to a commercial break and stick around. You don't want to miss this interview with Jack Hawthorne. Clearwater! Finally, health benefits designed just for you. Introducing Clearwater. They make your well-being a top priority.
You work hard for yourself. Now it's time for your health benefits to work hard for you.
At Clearwater, they understand every individual is unique. That's why they offer personalized support to guide you through the process.
Choose from a wide range of custom plans. Pay for only what you need and nothing more.
And you can get major savings too. Members can save up to 60%, up to $10,000 a year on their health benefits.
Real benefits, real solutions. Their health plans include comprehensive mental health coverage, $0 care, and the widest network available.
Clearwater, where health benefits are finally designed for you. To learn more, visit clearwaterhealth.com and book a consultation today to customize your plan and start living the healthiest life of your life. We are sitting right now, of course, we already, we talked about this earlier, but we are at the rim.
Yeah, we're at the rim outside of Lick.
Yeah.
We're gonna get licked after this.
Oh, that's a whole nother podcast.
Whoa!
That's a
Your subscriptions go up dramatically all of a sudden.
Hey, we've got our special guest from Clearwater, the one, the only, Mr. Jack Hawthorne.
Yeah. Thank you guys. It's good to see y'all.
Thank you for being here. Thank you for the support. Thank you for everything.
Absolutely, man.
We appreciate it. So we're coming at the end of the year. People are, getting ready to go into 2024. They got to come in with a good health plan, right?
That's right.
And you guys offer that at Clearwater. If you can, just tell our viewers, what Clearwater is,
Sure.
and why it's such a great decision for somebody to make if they're looking to get some health benefits.
No, absolutely. So, the thing about Clearwater that's really cool is it was started by a whole bunch of people that hate health insurance companies, that's a pretty easy person to find,
Yeah.
generally. These are guys that came out of a lot of different sales industries. One owned a mortgage company, one had a development company. They've all been real estate adjacent. And, like myself, I was in real estate for a decade. Healthcare sucked the whole time. It was really expensive. Everyone was unhappy about it. And so all those people came together and said, how do we start with things people hate? Fix those first. And then we get really, really specific about who it is we're trying to help. And so Clearwater as a company, the ideal avatar for the person who's our best client is a real estate agent making 50 grand a year.
That would be us.
Yeah.
Right. Well, we gotta get those numbers up though, right? We're getting to the end of the year, right? We gotta get them cranked up. But the idea there is saying most of the major companies, they don't care about 1099s. They get the warm and fuzzies from big groups. It makes them happy. They're very secure. It's low cost of acquisition, and they just don't have to really worry about it that much. Clearwater said, all right, let's just go help everybody that no one else cares about, which are independent business owners, entrepreneurs, the people that are actually trying to make it, right? And they're trying to live the American dream, build a business. And so we do what we've called kind of eliminating a barrier to exit, right? So you've got a barrier to entry to a lot of industries, but a big barrier of exit to having a real job that keeps you from financial freedom is healthcare.
Oh, okay.
And so Clearwater was built to say, look, let's just solve that problem first, and then we'll see where it takes us from there.
It seems like because I actually had a consultation with y'all.
Nice.
And the reason why is because I have a relationship with you. You actually helped us when you were in real estate. And the cool thing with y'all's company is it seems like they really do fabricate the perfect plan for you, and it doesn't seem like a daunting task because I feel like every time that I get a phone call from a healthcare provider or any of these insurance companies, I don't know if I'm sending my money to somewhere weird, and then I go to the doctor and then it's not actually covered. I feel like this it literally goes through all the lists that do you want this, do you not want this?
Right. The idea behind it is all of our salespeople, none of them are commission based. Right? There's no interest in upselling you. They're not going to lead generate. Honestly, if they were salespeople, they'd be the worst salespeople in the world. They are truly consultants. They're HR people.
Yeah.
They already work for you whether you realize it or not. So they are going to do a needs analysis. What do you care about? What do you not care about? Right? An experience that I've always had, and I tell this story all the time. My experience with health insurance for the last decade has been, I pay a bunch of money every month. I don't understand what I'm paying for. I go to the doctor. I still somehow owe money. I then somehow still owe the insurance company money. I get a bunch of letters over the next couple of months about, now you owe us, now we owe
From
you,
the
now you owe us. Just
from
everybody.
the clinic.
I do everything I'm supposed to do, and then I get a call from a collections agency saying you didn't pay your bill.
I hate when
And I'm
that happens.
this is the stupidest process ever. And so the thing that always frustrated me is that health insurance is really, really important, and it's really, really helpful, and the business practices around it are just terrible.
Yeah.
It's everyone decided sometime in the 80s that customer service didn't matter anymore in healthcare. And so we're trying to build, if healthcare had continued developing the same way everything else did, what would it look like in 2023?
Yeah.
And that's what we've looked to build. You've got someone who can actually walk you through it. I was in real estate for a decade. I never once understood my healthcare. right? Like I signed up at the last minute of the last day of open enrollment. I moved some
Deadline.
levers.
Yeah.
I was like, I gotta do it. I know something bad happens. It has something to do with my taxes. I don't know what it is, but it sounds terrible, right? And I think somehow it's Obama's fault. Like that was generally like that, and I didn't know. And so I jumped in, like I heard his name a lot. I don't know what's happening. I think I can control like a deductible versus a premium and this and that, but I didn't understand 95% of it. And so I said, all right, if we're going to do this, how do we create something where people can actually have someone walk them through it? This is what that person does. You know, Frank, like you guys are in real estate. I've consulted you guys as real estate agents.
Yeah.
Yes.
You're really, really, really good at a couple of things, but you're not great at everything.
No. Right.
This is one of the things most of us are not great at. And so instead of trying to become extremely knowledgeable about something that only matters for a tiny amount of time, why not just consult with an expert?
Yeah. Give it to the experts.
And then great. Then we move on from there. So that's the idea, is how do we make this simpler? You know, how do we meet people where they are? Right? If you have someone who really wants to get involved, cool. Let's have a bunch of conversations. Me and my wife had 3 consults where we signed up. Like, oh shit, someone actually can explain this to me.
Yeah,
This is
yeah.
exciting. I've never had this before.
Yeah.
It's so great. And it's, you know, I don't know about you, but I always get the text
Every day.
all the time, and I'm
For
like,
what?
from NAR or
Oh,
saying,
where
So
we
they're
got-
not from NAR though. That's
Yeah,
the thing.
see? I know.
They're just
That's what I'm telling
brokers
you.
that are lead generating.
Okay, so
Yeah.
listen, if you're watching, you're getting those. Don't fall for
I
it.
get
They're
those
not
every
called
day.
Clearwater.
I get 6 or 7 a day.
Yeah.
So I have a law license, which they do it for that. I have a real estate license, and they do it for that. And so I get hammered every single day.
It's so annoying.
I work with members of NAR. No, you don't. Like, this isn't even your real name, right? And by the way, if you respond, half of them don't even respond.
No. Yeah.
And so we were actually talking.
It's just fishing.
Yeah, we were talking to NAR a little while back because Clearwater partners with like trade associations.
Mm-hmm.
We're gonna hold off on that for a little bit, just see what happens with
Yeah,
that.
right,
But
right.
they've tried a couple of times to launch some stuff, you know, and what they settled on is they've just got a couple of brokers that said, okay, you guys can go do stuff. And then you have everyone else out there. Like, we're the easiest people to find in the world. My cell phone's been online since 2012.
Yeah.
Right? Because I need people to find me.
Yeah.
So it's really easy for a lead aggregator to scrub Zillow, to scrub online,
Realtor.com,
every
all
KW
that.
site,
Yeah.
every real estate site, and they're going to pull all of your data. And then they're going to sell it for, I'm going to sell 180,000 contacts for Texas realtors for $200.
Yeah.
And they're going to buy it, and they're going to put it in a power text program, and it's going to send it out. And if you have a percent of a percent of a percent of conversion, cool, you got a couple of enrollments. But if everyone does that, it is an absolutely terrible experience for everybody.
Yeah.
And that's where we're at.
Yeah.
So that's what we're trying to, well, you're never going to get a text from us
Yeah.
because I'm not going to do that. Because
Okay.
we always do things that resonate, right? It's kind of one of the real estate rules. I don't like cold calling because I don't like being cold called. I'm not a big door knocker because I don't like being door knocked. I like meeting people, so I like open houses. I don't like getting a bunch of random text messages, so I'm not going to do that to other people.
Yeah, and I think people can appreciate that. You know, we're all busy, and we're as realtors, we're getting slammed back and forth from just our clients and other realtors.
Right.
There's a lot going on, and then that's just another thing to add to it. I want to ask, you know, for anybody who's watching this, says, you know what, maybe Clearwater might be the perfect choice for me. What kind of coverages do you guys offer? Do you?
Sure. So everything. The idea behind Clearwater is we took the Costco approach, which is if you go to Costco, they've got everything, you know, on pallets, right? But it's everything. And then they've got their own products. So they've got Kirkland products. You've never seen a Kirkland's commercial.
No.
It's
You're right.
come to
I've never
Costco.
Yeah.
And we've got everything you need. Some of it we happen to own.
Okay.
But whatever it is you need, we got you. And so the idea behind coming to Clearwater is that if you're subsidized, like you make less than $55,000 a year, we got you. We'll help you get on a Blue Cross plan, whatever you need to be. You know, you will maximize your opportunity. If you are in a spot where you're not making subsidies anymore, we've got plans that essentially will replicate being a W-2 employee, even though you're an individual or a family.
Okay.
And so it's going to be way less expensive, but for full-blown major medical, like it's just insurance, but you now get the benefits of a W-2 plan.
Yeah.
So it just gets way less expensive. And then if you're over 65, we've got Medicare. So the idea is no matter what's going on, even if you're not enrolling in a Clearwater plan, you've got a licensed, experienced professional that will have a conversation with you, do a needs analysis. Your worst case scenario is you're now actually educated on the thing you're signing up for and you know how to use it.
Right.
That's the worst case because it's not enough to be like, okay, yeah, we're way less expensive. Cool. We have really good coverage. Cool. Doesn't matter if you don't use it. And so everyone's very education based. They lead with it saying, look, this is how you use it. And then for us, a huge premise, and it's actually paying off, it's a massive gamble, is, and this is going to sound super obvious, health insurance companies don't really work to keep people healthy, right?
No.
Their primary job is to mitigate risk. That's why you have deductibles and co-insurance and everything else. Like, you never quite get out of it, right? There's always something.
Right.
And you may not even know this. I certainly didn't. I learned a lot once I got into the industry. There are caps on most of your policies. You get to a certain point, they're not paying anymore.
Wow.
And if you tell me like, oh no, you got a $4 million medical bill, it's like, oh, but you have a $500,000 cap. Well, the difference between $3.5 million and $4 million in medical bills for me, that might as well be $15 million.
Right.
And so the thing that really bummed everybody out is 65% of bankruptcies in the U.S., the number one stated cause is medical debt.
Wow.
Yeah.
And of those, this is what's gross. Of those, 90% had insurance.
See?
So it didn't matter.
Wow.
And so we structured it in such a way that it's kind of, again, everything for me goes back to real estate because that's how I'm wired. Like, when I think of what I do, I still think of myself as a realtor first. I just happen to be in healthcare. And so whenever you go to the doctor now, like for Clearwater, we want you to actually go every year. Like, your physical's free. Your annual, if you're a lady's free. Your blood work is free. Like, deferred maintenance on the human body is really expensive, just like it is a house. It's always cheaper just to fix it up front.
Right.
And so we send people to the best doctors. We don't screw them around on their bills. We don't want them to not get their blood work done because they're worried about being surprised by something. And what we found is that we paid way more aggressively, and we pushed people, and we waived things, and everything was included for free. The average cost of insurance this year went up across the board 12.5%.
Okay.
With the BUCAs. So we call them Blue Cross, United, Cigna, Aetna. BUCAs.
Okay.
Clearwater went down 16%.
Oh,
Because
opposite direction.
It went the opposite direction. We're the only people that did it. And it's because we're actually taking care of people. And whenever you don't try and kick the can down the road, that lump on your neck doesn't become stage 4 cancer. Right? Like, that issue you're having doesn't become a massive surgery. And so it's like, hey, just go get it checked out. Just go get it taken care of. And if you let us get involved, because the health insurance industry is kind of so messed up, the average hospital in the United States upcharges 600% for everything they do. That's why a Tylenol costs $29, right? And so what'll happen is, if you go to the doctor, they're going to send us a bill. Let's say you need a knee replacement, right? You go to the doctor, they're going to send me a bill as your insurance company for $200,000. Well, we'll settle up somewhere, $100,000, whatever it may be, and that's why they charge so much. But if you let Clearwater know in advance, say, hey, I need a knee surgery. Cool, we're going to call, we're going to prepay it, we're going to take care of all of it. We'll probably pay them $20,000 because everything's so inflated. If you let us do that, we just waive your deductible. And so every plan at Clearwater is a zero deductible plan. So, like, me and my wife went on the highest deductible plan with the lowest monthly premium.
Wow.
But we'll never pay our deductible.
Zero deductible.
Zero deductible.
I mean, that right there is enough to make somebody say, oh, I'm sure people's ears perked up right now.
I know, that's
$0 deductible.
I was at W-2 and my insurance is $2,400 a month. Now, we had really good insurance. $2,400 a month.
for the kids too,
For
and the whole family.
Whole
Yeah.
family.
Wow.
When I went to Clearwater,
Okay.
went to $780 a month for better coverage, and my deductible went from $12,000 a year to $3,000.
Oh,
Holy
It's like,
crap!
I saved over $14,000 on just the premium, and I've paid nothing else. And I've had 2 surgeries, so it's like, I feel like I've reinvented fire, right?
That's
like,
why your
this
jawline
is-
looks great.
This is what it is, right? Yeah, we got to get cosmetics in it. But even cool stuff, right? Like, so one of the biggest trends we've got are people that want like alternative medicine.
Yeah.
We had someone the other day, we helped get their acupuncturist appointed as their primary care physician. We just launched, by the time this rolls out, right, it'll be public knowledge, and you guys will be the first ones to know it. We just officially launched the first phase of our partnership with Young Living, which is the largest employer in the world.
oh, wow.
1.9 million salespeople. But what we were able to do, because they do essential oils and a lot of other stuff, we were actually able to add their essential oils to our prescription formulary.
Wow.
So now it can be covered by your insurance to buy your essential oils
Wow.
because it's preventative.
Yeah.
Right?
That's a great partnership.
Well, right. Not every oil out there. Like, I don't know if you've seen the shirt. It's got like a big bloody, like a bullet hole. It's like, oh, my wife's got an oil for that, right?
Yeah.
Like, not everything is like doctor approved, whatever.
Sure.
But there are some that for sure, no questions asked. Like, this doesn't
They
work.
work. And people love those approaches.
Absolutely.
They love that natural approach.
Absolutely.
Sometimes when it comes to healing,
Yep.
they want to look for the natural stuff. They don't necessarily want something over the counter.
sucks. Yeah.
So the oils are a great way to.
Well, we're building plans. It's got
offset
cold
that.
plunges,
Wow,
like red light
sweet.
therapy,
Oh,
everything.
yeah.
Right?
Whoa,
it's
red
all,
light therapy,
It's
too.
all of the stuff that people like want. So
Yes.
again, we can either say,
But you
this
got to
is what
communicate
you
it
need.
to.
You got to
Yeah,
communicate.
yeah.
And you
What
have
do
to have
you-
a place to communicate it.
Exactly.
Right? Like every
That's
insurance company has a suggestion box that they just dump in the toilet every day,
Yeah.
right? But like ours is we actually have a lot of feedback. The president of our TPA, which is the company that actually runs like all the guts of an insurance company,
Mhm, yeah.
she's a homeopathic doctor.
Mm.
And so it's a really big passion point for her to say, like, how do we make these
Alternative.
things awesome?
Yes.
And so we're leaning in really heavily to what people actually care about.
Yeah.
So it's not just, look, this is what you need, deal with it. And it's not like there's no lobbying, there's no like we've kind of taken a hard stance on no exclusivity. We're not going to take a much bigger payment from some carrier because I can exclude other people. It's the idea behind it when they started this company. So the founders are named Jason and Doug. When they started this company, it was, we want to provide a solution for 1099s who have been a marginalized class. We want to drop their insurance cost 30 to 40%. That's what we want to do. And anything that doesn't hit that, we don't mess with it.
Yeah.
And so that's where everything goes.
Wow. Okay.
Yeah.
Man, I do want to ask you. I know we're kind of running out of
Of
time here,
course.
but I do want to say this. You guys have a really healthy network as well, right? So if anybody is thinking about, okay, this is the way
Absolutely.
to go,
Yeah, it's
you
not
got a
like
great network.
it's not like Jack's Friends.
Okay.
Right? Like it's the Aetna back network. Redundant on that is the United back network.
Okay.
And so the cool thing is there are 4 major networks because there's 4 major companies, and it's kind of like a rent a network, right?
Okay.
So we could create our own network, but it honestly wouldn't be as good because it would take decades to get everybody on there. Plus doctors move and whatever.
Yeah.
Of all the big networks, there's a 99% overlap. And so they're generally in everything. And sometimes someone will get paid for exclusivity or whatever, but that you can't do much about that one, right? So what we've done is said, all right, we're gonna take the biggest network in the US and we're gonna take the second biggest network in the US. And we're gonna provide both. And then in the event that you have a doctor that just doesn't take insurance or they're not in that network, we have what's called care coordination.
Okay.
And that's the person that'll reach out and say, hey, you've been working with Albert, or Albert wants to go see you. You're not in his network. If we paid you in cash up front, would you see him anyway?
Oh.
And so there's essentially no network.
Yeah, because
Okay.
I feel like a lot of these doctors, they've seen PPO, they've seen HMO.
Yep.
And there's some things that they just ingrained in them because they've been a doctor for 20 plus years. They're
Yep.
like, I don't work with that insurance.
That's right.
You know, because if they don't know it, they don't know if they're going to get paid or not after.
Well, and they know even if they do, it'll take forever.
oh, yeah. And then now their office is just
Right.
hunting.
Oh, it's awful. It's
Yeah.
a whole division. So the doctor, I go to a DPC, direct primary care.
Okay.
Pay $150 a month, and I can go every day. I can text my doctor. They do all my stuff is included. Doesn't cost anything extra. Well, those are cash pay. Like they don't take insurance, so they don't want to deal with it. They will work with Clearwater though, because it's cash pay.
Yeah.
And so they just call and say, hey, we're going to pay for Jack to go once a month, and that's all it's preventative.
Wow.
And so we'll just work with you kind of with whatever you need.
Mm-hmm.
And then the idea behind it is it's not something to get you in that then we move on from.
Yeah, exactly.
And so we actually hire off of an algorithm. So we know for X amount of lives that we insure, we automatically hire another customer support person, another billing person, another whatever. There's no decisions. It triggers the recruiter goes to the bench, they go do their thing, but there's no internal hiring discussions. We know this many people requires this much support to have a good customer
Healthy,
service
yeah.
experience. And we just track with that. So you never have the option to accidentally outrun your coverage. We usually stay overstaffed by about 30% so that when we do get a big influx, we're always good. Now, we had a group move over the other day. It's 2,500 employees.
Oh, wow.
And within a week, they had gone from not being there to us having all 2,500.
yeah.
Well, we were fine because we were completely staffed up for it. And then we hired again just to stay ahead.
Yep.
So the idea is focus on customer experience, drop the costs, and make sure everyone has a good, just a good user experience end to end. And health insurance is not that complicated. We've just allowed it to become complicated over, the last
And
couple
political.
of years. It's become very
That's
political.
what it- that's
Number
what it
one
is.
question I get, because people, being snarky, right? And they're like, do you have any questions? Right after I talk about who are you lobbying right now?
Oh.
I'm like, well, I don't know who to lobby. We don't have a lobbyist, but if I was going to lobby stuff, I do have, a couple of things I'd love to lobby, but they're healthcare specific, right? It's not Clearwater should be better. It's maybe we should change the way that that healthcare companies can allocate
As a
their
whole.
profits.
Yeah.
Right,
Yeah.
like just business ethics in general. So yeah, I've got a list.
Yeah.
But they're not anything that's going to be particularly helpful to us. And we know we're doing a good job because I've already had 2 of the major 4 insurance companies threaten to sue us for nonsensical stuff. So I know we're making a dent in the universe.
Yeah,
it
You're
is
making a name for yourself.
yeah, it is not in my nature to be low conflict,
Oh my
unfortunately. And so we're getting a lot of attention. We're growing about 15% a month right now.
Congratulations.
And it's
on that.
exciting. Well, it's very little to do with me, man. Like this is
It's all because of you.
this is the easiest thing I've ever had to sell.
Yeah.
Wow.
Right? It's so
it sells
exciting.
itself, right? It sells
It really
itself.
does. Like I actually get to feel like I'm making a fundamental shift in a whole industry. Like my stated goal was by the end of next year, if you are a real estate brokerage or association and you don't offer a meaningful healthcare solution, you're irrelevant.
Yep.
Yeah.
Okay.
And that's my goal.
Yep. And I think when you go to their website at clearwaterhealth.com, you'll see there they offer it not only to just individuals and families, but you also do businesses as well.
Absolutely.
So you guys are making a dent in this industry all the way around.
That's right.
So for anybody who's watching, tell us where they can go.
Absolutely.
And how they. I mean, I don't think they get a hold of you specifically, but they go straight to the website.
Yeah. Now, granted, I'm not hard to find, right? If you do
He's
get a hold
an
of me,
icon,
I'm gonna
everyone. You'll find him.
There you go. Right, yeah. I just look like a big thumb, right? I'm easy. Now, so you're gonna go to clearwaterhealth.com. No matter what you need, that's the place to start, right? If you want to book a consult with me to talk about a trade association, let's do it. If you want to schedule a consultation for you and your family, that's the place you go. If you're a business, like, hey, I want to see if you guys can save us a bunch of money with our current employees, or our current employees hate our healthcare. Like, what can you do to make this better? Like, we're trying to actually invest in our people. Regardless of what it is you need, clearwaterhealth.com is where you start, and then you kind of choose your own adventure from there.
Yeah, I love that. And I think you and I talked about this, is that when I last worked for Ken's 5, that insurance was outrageous.
Right.
I mean, like I was really working just to pay the insurance.
Right.
That's really all I was doing.
Holy moly.
So this is a great alternative, and it's obviously it's going to be a way to save us more money. So go guys, check out clearwaterhealth.com. Jack, thank you so much for being here.
Thank you guys for
I
having
wanted
me,
to say
man.
this real quickly because we have a really funny story that when we first met you, Davin and I were going to go to a different real estate brokerage, and you called me up and said, "Hey, let me talk to you. I'd like to throw a wrench in your plans." And I said, no, that's fine. I'm planning on still going over here. And you said, okay, that's fine. Well, just meet with me anyway. And I said, yeah, of course I'll meet with you. And then before I knew it,
Like 2 days later, I think you're joining. Listen,
we made the switch.
I told you with as much love in my heart, I will T-bone your car on your way to the office. If you do not meet with me, we will have a conversation.
That's great.
Because I get excited when I can actually help people.
Yeah.
I get excited. It's one of the reasons, like on this, right? I get so excited. No one in my company even knows what I do. They're just like, I know he's pumped about it. He's passionate. Like, we want to be involved, but I couldn't tell you what your job is to save your life.
Yeah.
And I'm completely comfortable with that.
love it, man. Jack
All right,
Hawthorne, thank you so much for joining us.
Thanks,
a big
guys.
thank you to Clearwater for today's episode. We've come to the end.
Yep.
Make sure you go visit their website, clearwaterhealth.com. All
Thank you,
right,
Jack.
guys. We will see
Thanks,
you
guys.
next time.
You guys have the rhythm for all of us.
We
That's
do.
the way you gotta do it.
Y'all for real, dog?